Hi everyone, Wynn Brown here on Wednesday, the 22nd of April with our Haywood Healthcare COVID-19 morning update. Actually, it's just afternoon time and I apologize for the late posting of this. It's been a morning filled with tons of meetings and Zoom calls, and so I'm just getting caught up, and so apologize about that. So let me take you right to the numbers, which is where we always start. To date, we have tested 1,780 individuals with 1,359 negative results, 285 positive, and 16 indeterminate for a positive rate of 17.3, so right in the zone that we've been hanging out in for a while now. Statewide, the positive rate is at 23.5, so I think our self-quarantine work that we have been doing and staying at home and good hand hygiene has really paid off for us to be below the state average. So thank you to everybody who continues to do that. Worcester County, we're up to 3,341 cases. Franklin County is inched up to 192. I was in conversation today with UMass in Worcester, and they feel that they are coming over the crest of the surge right now. I think we've just been really in a constant position for us. So whether we've crested or not, I can't quite tell you at this point in time. The data would seem to tell you that we have plateaued and are coming down a little bit, but that, as you know, that tail is going to be a long, long tail until we have widespread testing and a vaccine in particular. So please keep up the good work. At Haywood Hospital, we have 8 positive inpatients, 3 of whom are in our ICU. We have no one on a ventilator who is COVID positive right now, so we continue to be doing very well on that. A huge kudos to Athol Primary Care. Yesterday, Medicare approved their exemplary provider accreditation status so that they can become a rural health clinic officially. And that is just an important thing for that practice, joining Tully Family Medicine with that status. It allows them to apply for specific federal grants, educational loan repayment opportunities for the providers in that practice, and other things that go with being a rural health clinic. So congratulations to everyone. That was actually done virtually. So who knew you could do the accreditation visit virtually, but that went well and it went off without a hitch. So kudos to everybody. The communities in Athol and Haywood are going to do salutes to the 2 hospitals tomorrow, which means that there's going to be a parade of fire trucks and EMS providers and police driving by the hospitals to salute the staff, which you probably have seen happening in other communities, and so we're excited about that. Athol's salute is at 3 o'clock, and Haywood's is at 4 o'clock, and so staff can look out the windows or be out front for that at that point in time to be welcomed and thanked for that. So thank you to our communities who are continue to respond and support us in myriad ways. Some shout outs today. DW Design Lettering and Apparel, which is Dennis Whitcomb, has donated a percentage of his Haywood Strong hat, my favorite toque, and the lawn signs to support us. So that goes to our Caring for Colleagues Fund. And then Brian LaRoche from Sharp Image has been coordinating our apparel sales, which you know are going on through Friday. They probably will come back a little while later as well, but we just need to catch up with all the orders and make sure everybody gets their swag so that they can be Haywood and Athol strong. To date, these 2 programs have raised $13,000 for Caring for Colleagues. And then just we had a nice message today from a community member came in. She says, yesterday I had an unexpected visit to the hospital. Your emergency department staff and then the surgical staff were outstanding. Everyone that cared for me was amazing, especially with the current health issues in the community. They were so pleasant and professional. Thank you, everyone. So nice to have community members being pleased with the services we're providing in the midst of this pandemic. Remember, we are open for business. The majority of our medical practices are open for in-person and virtual visits, as are our urgent care and walk-in care facilities as well. We are going to be adjusting our walk-in care and urgent care times coming up, and I'll be announcing that. We're going to shorten the day a little bit on them as the volume is lower in the evening, and we've been monitoring that. So that's all for this morning. I'll get back to you this evening with an update to let you know how the rest of the day went. Until then, be well, and thank you for all you're doing to keep us on our journey to be one of the best community-owned health systems in America. Have a great day.